All right, you welcome back. So we pick it from there. I was talking about osteoarthritis, and I've told you all the symptoms or most of the symptoms associated with osteoarthritis. Let's go into rheumatoid arthritis. Rheumatoid arthritis. What is rheumatoid arthritis? It is actually a serious disease which affects not only the joints and the fingers, but the wrists, the hips, and the feet. And listen, it also affects your muscles, it affects your tendons, it affects the tissues of the body. Rheumatoid arthritis is actually this dangerous, and I'm going to try to break it down so that you will understand the effect and the symptoms of rheumatoid arthritis. It affects your bones, it affects your wrists, it affects your hips, it affects your fingers, it affects your knees, it affects your muscles, it affects your tendons, it affects other tissues in the body. My goodness, and it is actually also an inflammatory disease. Rheumatoid arthritis, as well as osteoarthritis, is also an inflammatory disease. Remember, it is arthron getting married to itis that causes arthritis. All right, these two come together, then what we have is arthritis. We've talked about osteoarthritis, and here is rheumatoid arthritis, affecting the wrist, affecting the knees, affecting the legs, affecting the fingers, affecting the muscles, affecting the tendons and the tissues. Rheumatoid arthritis rather can eat up your tissue, it can eat up your skin, it can eat up any organ of the body. It can eat you up, literally. It can eat you up. It's that serious. It's an inflammatory disease that affects all parts of the body. Now, rheumatoid arthritis is also is a disease caused by an inflammatory process of the synovium, or the lining of the joints. This one is the synovium, or what we call the lining of the joints. Now, the joint has linings, right? A semi-permeable membrane that lines the joints, and that synovium, or that lining, becomes inflamed, right? And when it becomes inflamed, then this is as a result of rheumatoid arthritis, and it also leads to deformity. So whichever form of arthritis someone may be having, understand that both of these or all of these leads to deformity. In rheumatoid arthritis, it is often called the cooked food disease. It is understood that the more cooked food you consume, the more at risk you are of developing rheumatoid arthritis. That is why it is important that we eat our food 70% raw food and 30% cooked food. That means you have to indulge in fruits and vegetables. You have to eat more fruits and vegetables. You have to eat more raw fruits. Don't overcook your food, because rheumatoid arthritis has been caused the cooked food syndrome. That means if you are eating more of raw food, more of plants based food, more of veggies and fruits raw, then you are going to be lowering your risk of developing rheumatoid arthritis. It usually develops gradually. It is not something that comes overnight, right? It takes time to develop, and of course it can take several months before it is well established. And one of the things that you will be feeling is this constant pain and stiffness, and because it builds up over time, there is this tendency for people to overlook it. Many people are just going to take some painkillers to mask the pain and ignore it until it comes back. Rheumatoid arthritis can really take time, and ultimately the whole body is affected. So if you don't treat it when it first knocks, then if you wait, it may affect the entire body. Symptoms of rheumatoid arthritis, and please, I wanted to take note of this, because you see, most of the things that people do is to treat symptoms, and when you treat symptoms without an idea of the underlying cause, you're always going to get it wrong. One of the symptoms, or let me just give you some of the symptoms of rheumatoid arthritis. Number one, anemia, right? Loss of blood, low blood level. So every time you check your blood level and it's low, it could be that you are having rheumatoid arthritis. And then you also have colitis. This is another itis, right? This is actually the inflammation of the of the lining of the intestine. So there is colitis, there is constipation. You could actually be having rheumatoid arthritis when you are experiencing that constipation. But whoever told you that rheumatoid arthritis will cause constipation? Of course, this is only the place that you can get this kind of information. There is gallbladder issues, there is disturbances in there is low blood pressure, there is deformed hands and feet. You see, there are people that they can't grab right, their hands are deformed, so there is deformed hands and feet as a result of this problem. And this condition may be caused by hormonal imbalance. Hormonal imbalance, when not properly treated, can lead to rheumatoid arthritis. And then there is also a physical and emotional stress. Listen, don't put yourself in a place of stress consistently. Walk away from anything that is giving you undue stress. Find a way of de-stressing. Find a way of finding happiness, removing pent-up emotions. Cry if you may. Listen, we are all human, and sometimes people feel that you should be superhuman. The reason why we cry is because we do not want to hold it in to cause disease to us. The body have a way of releasing these things. Pent up emotions, unresolved emotional trauma can actually lead to rheumatoid arthritis. Emotional stress, infection, severe fright. If you were so afraid, if you were anxious, if you have something that made you so afraid, then it can predispose you to rheumatoid arthritis. Shock can also cause it, and an injury can also cause it. Whatever disturbs the balance of the body can lead to this particular situation, rheumatoid arthritis. And also, very little percent of rheumatoid arthritis is actually hereditary, right? I usually do not want you to blame anything on something you cannot control. We all are predisposed to a hereditary condition, but I believe that if we take time and do what we need to do the right thing, then we won't have this problem of hereditary, right? All right, now when I come back, I'm going to talk to you about the treatment. Now that you understand your symptoms and you know what is causing them, why don't we talk about what you really need to do to get rid of this? Stay with me and I will be back.